Welcome to Seeb. It's a rapidly expanding corner of Muscat where tradition meets modern living, and the community is defined by its large, multi-generational families living closely together. For these families, finding specialized healthcare often introduces a logistical headache. It usually means navigating heavy, time-consuming city traffic just to piece together different dental treatments at entirely separate clinics. The alternative is centralizing that care. By placing a comprehensive facility right in the neighborhood, a single clinic can handle everything from a toddler's first checkup to a grandparent's complex oral surgery. Removing that geographical barrier means consistent care actually happens. When the friction of commuting is gone, every generation has straightforward access to specialized, international standard treatments under one roof. Building that lifelong consistency starts with the youngest patients. For children, unaddressed anxiety acts as the primary barrier to maintaining the regular checkups required for long-term health. Pediatric specialists tackle this through psychology first. Using gentle, playful interactions, they work to replace the child's natural apprehension with a solid foundation of trust. Once trust is established, mechanical prevention begins. On this pediatric molar cross-section, a transparent sealant flows into deep enamel grooves, blocking bacteria. Next, a fluoride varnish, a concentrated mineral treatment, hardens over the entire crown, armoring the tooth against cavities. Establishing these healthy habits and physical defenses early on creates a protective foundation. By neutralizing risks during childhood, the clinic significantly reduces the likelihood that these patients will require invasive, complex interventions later in life. As those children grow into teenagers and young adults, their dental needs shift toward alignment and aesthetic corrections. The days of sitting through uncomfortable, messy physical impression molds are over. Clinics now map your mouth using high-precision 3D digital scanners to create an exact, high-resolution replica of your teeth. These precise digital models allow orthodontists to craft targeted, lifestyle-friendly solutions. Patients can skip the heavy metal and opt for discrete ceramic brackets or virtually invisible clear aligners that smoothly shift teeth into place. For adults focused on aesthetics, the technology scales up as well. Years of enjoying strong traditional Omani kahwa can leave stubborn enamel stains, but in-office laser bleaching actively lifts multiple shades of discoloration in roughly an hour. Upgrading to this level of digital precision drastically reduces diagnostic errors. It turns prolonged, uncomfortable corrections into fast, predictable treatments that are practically invisible to everyone else. Of course, routine care can't prevent every emergency. When severe, throbbing toothaches strike, it usually indicates a deep nerve infection that disrupts daily life and requires immediate intervention. The goal of modern endodontics, the field focused on treating the inside of the tooth, is preservation. Instead of hastily extracting a painful tooth, specialists focus on saving it through completely numbed, stress-free root canal therapy. This schematic demonstrates exactly how that procedure is kept precise and painless. A device called a digital apex locator uses a sensor to map the exact depth and curvature of the infected nerve pathway, ensuring the specialist cleans the area perfectly without going too deep. But none of these advanced procedures can happen without a strict, invisible foundation of safety. Patient protection requires a hospital-grade sterilization environment, deploying specialized machines called Class B autoclaves that use pressurized steam to completely sanitize instruments. That hidden infrastructure is non-negotiable. Cutting-edge digital dentistry relies entirely on these absolute protocols to eliminate cross-infection risks and keep the clinic running safely. As patients reach their senior years, the clinical focus shifts again. Missing teeth create significant functional losses, making it difficult to confidently eat favorite traditional meals or maintain a natural bite. This animation illustrates the definitive modern solution: permanent titanium implants. Through a biological process called osseointegration, the titanium post is actively accepted by the body, fusing seamlessly with the surrounding cellular matrix of the jawbone. Placing these implants requires meticulous preparation. Certified surgeons rely on 3D scanning to calculate the exact angle and depth for the post, which minimizes the surgical footprint and vastly improves the patient's recovery time. Because they integrate directly with your anatomy, implants serve as structural replacements. They restore your full natural bite force and actively halt the progressive facial bone loss that typically follows an extraction. When you zoom out and look at the entire lifespan of a patient, the true value of a comprehensive clinical ecosystem becomes clear. Having internationally credentialed specialists delivering this caliber of multi-generational care right next door provides a massive logistical and emotional advantage for the community. The clinic's ultimate goal extends past fixing immediate problems. It is about actively educating patients and elevating the overall oral hygiene standards of Seeb residents over time. A true dental home delivers ultimate peace of mind. It ensures that an entire family's smiles remain vibrant and healthy for decades, safely and conveniently, without anyone ever having to leave the neighborhood.